So good day everyone, we are the group 8 and I'm Rinalyn, and for today we will talk about the gene therapy methods of gene therapy, pros and cons, and ethical issues of gene therapies. So what should we be able to learn in this lesson or video? So first, we should learn what are the methods rather of gene therapy, which is the physical and chemical method. Next is what are the pros and cons of gene therapy? And lastly, what are the ethical issues of gene therapy? So first, let's all talk about the methods of gene therapy. So dito, there are direct gene transfer, non-viral method in gene therapy. So this method do not use bacteria as mediators for integration of DNA into host genome. The direct gene transfer can be broadly divided into two categories. So, ito direct gene transfer is ito naman yung method na kung saan hindi ka gagamit ng bacteria para ma-fix mo or magamot mo yung isang sakit. For example, sa bakuna, yung bakuna kasi dead bacteria yun na inuusok sa atin so that our body can learn how they can learn paano malabanan yung sakit na yun at the same time maging immune nun. So, dito, iba naman siya. Hindi siya katulad ng sa sa bakuna. Hindi ka gagamit ng bacteria. And meron pong dalawa categories that may other groupmates will be discussed with.
Good day, everyone. I'm Rachel Animanakon, and today we're talking about physical method. In year 1980, when starting using physical method as the alternative in chemical method, physical method of gene transfer become increasingly applied in biomedical research due to its safety and simplicity in comparison to the other method. Moreover, physical method became challenging when the internal organ is the primary target of gene transfer and its need invasive procedure. And here's the example of physical method. Electroporation, biolistics, vacuum infiltration, ultrasound, shock waves, micro and macro injection, and last, electrophoresis. And that's it, and that's my insight. Thank you. Bye-bye.
Hello everyone, my name is Divina Mitalaba and I'm going to explain the chemical methods of gene therapy. The chemical method utilizes calcium phosphate, DEA dextran, liposomes, and nanoparticles for transfection. Let's start with calcium phosphate or DNA coprecipitation. Calcium phosphate or DNA coprecipitation known for affordability and ease of use for DNA phosphate introduction. Calcium phosphate or DNA coprecipitation known for affordability and ease of use for DNA plasmid introduction. This method is affordable and straightforward for introducing DNA plasmids into cells. It involves the formation of DNA calcium phosphate precipitate, which is added to cultured cells. Despite being simple, it may cause neural toxicity in primary neurons. By optimizing transfection parameters and using neural activity inhibitors, low toxicity and unreasonable transfection efficiency from 0.5% to 5% can be achieved. The third one is liposomes. Liposomes for DNA delivery. Liposomes promising vectors for targeted delivery of DNA and other substances, with efficacy influenced by various factors. Liposomes are promising vectors for delivering DNA and other substances, offering versatility. They can be designed to target specific cells and incorporate various substances. The efficacy of liposomes depends on factors like their size, surface charge, and lipid composition. Chemical modifications can enhance their performance for targeted and controlled delivery. Liposomes are suitable for delivering not only nucleic acids but also other targeting ligands. Their success in gene delivery is multifactorial, and well-designed liposomal systems can optimize gene transfection, especially in vivo. The last one is nanoparticles. Nanoparticles acting as non-viral vectors for DNA transport across cell membranes through endocytosis. Nanoparticles are tiny particles with dimensions at a nanoscale. They have diverse applications, including drug delivery, imaging, and gene transfection. Nanoparticles can be engineered to enhance drug or gene delivery to specific targets. Their small size and large surface area make them effective carriers for various substances.
So, good day guys. Good day, ma'am. Here's our advantage and disadvantage of gene therapy. Let's talk about first on advantage. So, nagbibigay ng mga pagpipilian ng gene therapy ay maaaring potential na pagalingin ng isang tao sa isang sakit, lalo na sa mga pagkakataon kung saan walang ibang gamot ang gumana. Isang beses lang dapat ibigay. Ang mga kasalukuyang gene therapies ay ibinibigay bilang isang beses na dosis. Ito ay nakakaakit kumpara sa ilang iba pang paggamot na nangangailangan ng maraming dosis. Pangmatagalang epekto, ang gene therapy ay may potential na maalis ang mga sintomas ng isang tao habang buhay. Ang gene therapy ay maaaring magbigay ng maraming tao ng mas magandang kalidad ng buhay. Ang mga positibong epekto ay ipinasa sa mga henerasyon. Kung aalisin mo ang isang may sira na gene mula sa isang magulang, hindi nila ililipat ang gene na ito sa kanilang mga anak. Mabilis na pagbabago ng teknolohiya. Ang gene therapy ay maaaring umiral dahil sa napakalaking pag-unlad ng teknolohiya. Sa nakalipas na ilang dekada, dahil ang teknolohiya ay patuloy na sumusulong, maaari nating asahan ng gene therapy na patuloy ng bubuti. Maaari din nating asahan ng higit pang mga gene therapies upang makakuha ng pag-aaproba ng FDA. So, let's talk about disadvantage. Mahal ang gene therapy. Ayun yung disadvantage ng gene therapy. Maaring maging lubhang mahal na ginagawa ito, hindi na-access para sa ilang mga tao. Halimbawa, ang Zolgensma, isang gene therapy upang gamutin ang spinal muscular atrophy, ay ang pinakamahal na gamot sa US na nagkakahalaga ito ng $2.1 million para sa isang kurso na paggamot. Experimental gene therapy is a relatively new, and there's still a lot about it that we don't know. Right now, there are no guarantees exactly how a successful gene therapy will be still uncertain. May ilang pag-aalala na kung ang gene therapy ay umaabot sa iba pang mga cell sa katawan bukod sa may sira na cell, maaari itong magkaroon ng nakakapinsalang epekto. Meron ding pag-aalala na ang mga reproductive cell ay maaring magbago ng walang pagtuklas. At ang mga ito ay maaaring maipasa sa mga anak ng mga tao, mga isyong ethical. Ang ilang mga tao ay may issue sa etika sa gene therapy. For example, some wonder who will decide what good and bad uses of gene therapy are. And will gene therapy make us less accepting of people who are different? So that's our disadvantage and advantage gene therapy. Thank you.
Gene therapy is a promising field of biotechnology that holds the potential to treat genetic and acquired diseases by modifying or replacing defective genes. However, it also raises several ethical issues that need careful consideration. Hi, I am TJ, and I will discuss the ethical issues on gene therapy. We present to you some of the key ethical concerns associated with gene therapy. First is safety. It is crucial to guarantee the safety of gene therapy procedures. There have been cases in clinical trials that have resulted in disastrous events, including fatalities or death. When a treatment's possible advantages are balanced against its hazards, its risks, ethical issues can arise, particularly when it comes to experimental therapies. Second, informed consent. It is essential to obtain informed consent from the patients or research participants. Individuals must understand the risk and benefits of gene therapy, the potential uncertainties, and the experimental nature of some treatments. However, given that germline gene editing may have an impact on future generations, informed consent is especially complicated in this situation. Why? Simple. Future generations cannot provide informed consent. Rather, the present generations are the ones who do the consent instead of them. Third, justice, access, and equity. Like with many new technology, there are worries that genome editing may remain a luxury of the wealth and worsen already existing inequalities in access to other interventions such as healthcare. Some fear that if germline editing is applied too broadly, it may result in classes of people who based only on the caliber of their modified genomes. Fourth and last would be the genome editing research involving embryos. Through the process of germline gene editing, the DNA of embryos or germ cells is altered, potentially resulting in genetic alterations that will be inherited by the next generation. The use of this technology is the subject of ethical issues because of worries about unforeseen consequences and the possibility of what we call designer babies. Furthermore, a lot of people object to the use of human embryos for research due to moral and religious concerns. Research involving the creation or destruction of embryos is prohibited from using federal funds. Other ethical issues includes genetic discrimination, off-target effects or unintended genetic changes, human enhancement or the use of gene therapy for non-therapeutic purposes such as enhancing physical or cognitive traits, which would actually raise ethical questions about the definition of normalcy and the potential for creating societal divisions. There are also concerns about the long-term effects of gene therapy, animal testing, and the dual-use dilemma, or the use of gene editing techniques for both therapeutic and potentially harmful purposes.
So, before we end this video, we want to share our insights in this topic. So, our first insight is gene therapy might help people with medical disorders or disease. Yung gene therapy kasi makatulong siya to help other people, especially yung may, yung may genetic disease na sa kanila na dala-dala nila and they don't want to pass this to the next generation sa kanilang anak, sa kanilang apo, and so on. So, next is the gene therapy provides long-lasting positive effects and can positively impact their lives. So, itong gene therapy na to, long-lasting siya, like, hindi siya totally panghabang buhay, pero mas magtatagal siya. Kaya nga, pwede mo siya mapasa sa iba eh. So, marami din siyang positive effects na pwedeng makatulong sa magiging, sa magiging apo mo or sa magiging susunod na henerasyon sa pamilya nyo or sa angkan nyo. So, next is, gene therapy might also pose a threat to someone's life. While we know that technology has greatly improved nowadays, the risk might be low, but it can be still dangerous, especially in challenging situations. So, kasi ngayon, all we know na mas advanced na yung technology natin, but let's not forget na may risk pa rin. Like, may chance pa din na it can be dangerous to us or it can be dangerous to someone na makikita ng gene therapy. So, pwede maka-apekto yun sa physical or mental nila and have a dangerous or risk to their lives. And lastly, nowadays, embryos can be edited to determine their gender, appearance, and potentially their intelligence in the future, which can have an impact on the human race. So, gene therapy na pwede din ma-involve dito yung mga embryos or kasi if I remember sa China, they start editing or practicing this na ina-edit yung embryo tapos yung appearance niya, yung gender niya, nagagawa na nila siyang baguhin or i-customize like that. And this can be a potentially danger to our future. Bakit? Kasi nawawalan na yung pagiging nature natin or natural human kasi ina-edit na or alam mo na agad kung ano yung magiging kalalabasan ng isang embryo na kung naging bata na siya, alam mo na yung possible na mukha niya, yung possible na skills or etc. So, these are video recording and we hope that you learned something with us. So, thank you very much and again, we are Lukuti from BSTMC 1A.